This PowerPoint will cover the gram-positive bacilli, more specifically the ones that grow within aerobic conditions, and there are others that will be covered later on. Here's a flowchart describing how the gram-positive bacilli are identified based on whether or not they produce spores. And then from there, it is divided out based on that criteria. There are a couple that are on this chart that we will cover later. So for now, you would just kind of overlook those within this flowchart. First, what we'll talk about will be the spore-forming gram-positive bacilli. So if you were to look at these on a microscope, then they would have a spore within that bacilli. And so within the spore-forming bacilli, they are divided out into non-hemolytic and non-motile, and hemolytic and motile. So when we look at our spore-forming gram-positive bacilli, these are aerobic organisms. They are catalase positive, and they are large gram-positive bacilli that can have spores. So if you look at this gram stain over here to the right, you can see several of these bacilli do have spores within them. And because of those spores, they can cause them to be gram-variable, where that crystal violet does not stain those spores, so it can kind of have a pink tinge to it instead of that deep purple look. And so that can be a little confusing. You can see that some of these do not have spores in them, and so you do have some of these species, they don't produce spores, and they may not always produce them, just depends on their condition. Some people think that this type of morphology resembles a bamboo type appearance. Your bacillus species are usually found within the soil, but they primarily cause disease within wild and domesticated animals, so particularly your herbivores, which would be something like your sheep, goats, cattle. And what they do is they eat these spores and then they become contaminated themselves. So humans will acquire infections when they're inoculated with these endospores, so this could be through some sort of traumatic type of inoculation, through some sort of injury. They can be ingested, inhaled, or they can also be injected into the system. With Bacillus anthracis, they produce the endospores, which are highly resistant to the heat and any sort of deterioration. So these endospores can remain dormant until they are deposited in some sort of suitable environment for growth. So this can make them, it can make the Bacillus anthracis used as a biological weapon because these endospores are very resistant. So Bacillus anthracis is a non-hemolytic organism, and when it grows on the agar plate, it can have a very dry, irregular appearance to it. And so some people think that this kind of appears like a ground glass or a Medusa head type appearance to these colonies. So you can see here at the bottom where you have this irregular shape around these edges of these colonies, and they kind of spike out. And some of them are a little bit more than others, but you can see that kind of ground glass appearance around the edges and kind of spiky. Some people think that this resembles a string of pearls when these kind of grow together, these colonies side by side. Then you have what can resemble a string of pearls. And so with these, they also have, the individual colonies have a tenacity, a positive tenacity. And so what this is that when you touch the colony with a loop, then it will cause the colony itself to stand up, similar to what if you were to do like beaten egg whites and you try to form that stiff peak. These organisms again do have the spore within those bacilli. They are catalase positive, and they will not grow on the PEA agar. They are non-motile, sensitive to penicillin, and because they can transition from the vegetative cells to spores under harsh conditions, then that allows them to survive a lot of different environments for a very long time. Bacillus anthracis infection is more commonly referred to as an anthrax infection. And so there are several forms of it. With a cutaneous infection, this is the majority of the infections that are caused. And what will happen is the endospores will enter into a break in the skin. And then from there, it starts to have an incubation period, about 1 to 12 days. And with that, you start seeing a little bit of a damage to the skin. And as the disease progresses, it will start to kill the skin, and it will become black and necrotic. If it is left untreated, it has about a 20 to 25% mortality rate. However, with treatment, with antibiotic, it does lower that to about 1%. With a gastrointestinal infection, the endospores are ingested, and so this can include transmission through oral or pharyngeal ingestion. And then what will happen is the patient will develop abdominal distress, something like bloody vomiting or diarrhea, a fever, and then they'll start developing signs of septicemia. And so as this disease progresses, it will has an incubation period about 1 to 7 days. And then if there's early treatment with it, then the case fatality rate is about 25 to 60%. And what will happen with this is the patient goes into a septicemia type state that is caused by a toxin. And so in the end, the patient can not survive this, potentially not survive this illness. Inhalation of anthrax is also known as wool sorter's disease. And what happens with this is those spores are inhaled once the patient comes in contact with an animal that is infected or contaminated by these spores. The initial infection will start off as a viral type infection with fatigue, fever, and as it spreads through the lymph nodes, it becomes more symptomatic. And then once it reaches a more severe phase, the patient will experience respiratory distress. They will have an abnormal chest x-ray, and the patient's risk of mortality is about 97% without treatment and 75% with treatment of antibiotics. So it's very important to recognize this disease very early. Patients can also be injected with anthrax, and this is typically through contaminated drug usage, so drugs of abuse. And symptoms can differ slightly through the cutaneous anthrax because they do not get that characteristic necrosis of the skin. And so it will present as a severe soft tissue infection, which will rapidly disseminate, that will result in septic shock. Plasmid-borne toxins are not toxic individually. However, when they work together, they do cause damaging effects. And the toxin encoding plasma can be lost over time, and this will reduce how pathogenic the organism is. And so we see this when a culture is set up and then it's subcultured again, and then another day it's cultured again, and then from that culture it's cultured again. So over time it will lose its ability to be pathogenic. Bacillus cereus is also a gram-positive bacilli that has spores. And this organism can look very similar to the Bacillus anthracis. This one has that large frosted glass feathery type appearance, but the main difference that you need to focus on with this is that this one is beta hemolytic on the sheep blood agar, so you can see where it has that hemolysis around that colony growth with these really large colonies. This organism is motile, It is penicillin resistant and it will not grow on PEA agar. It is found throughout nature within the soil, and it is associated with contaminated drug use. The infections caused by this is a food poisoning type infection, post-traumatic eye infection, or it can be a systemic disease like bacteremia, septicemia, endocarditis. With your food poisoning, you have two types. You have a type which causes diarrhea, and with this you have abdominal pain, watery diarrhea, and then you also have a type that causes profuse vomiting, and this is typically associated with eating something like fried rice. And so what happens is the toxin itself that's in the rice from where the bacteria has been inside the rice and has not been heated properly to destroy that organism, then that toxin that is produced is what actually causes that patient to have that food poisoning type of illness. If the patient actually ingests the organism instead of the toxin, then they get the diarrhea type of food poisoning. So Bacillus is treatable. However, there are some species that can exhibit the beta-lactamase and can become resistant to penicillin. And so some patients can also, if they're going to be at risk, they could be inoculated with a vaccine to help prevent infection. If your aerobic culture demonstrates an organism that is a gram-positive bacilli, however, it is not a spore-forming organism, then from there they can be differentiated based on a catalase test. Once you've decided that you're most likely dealing with a non-spore-forming gram-positive bacilli and you test it to be catalase positive, from there you will determine the motility in the esculin hydrolysis test. From there you could differentiate if it's a listeria. With this one, your culture will be aerobic with a narrow zone of beta hemolysis. But these organisms are a little bit different because they can grow at 4 degrees Celsius, so this is a cold environment. They ferment glucose and they are positive for a VP test and a CAMP test. With presumptive ID, this can typically be done based on the motility. And so with that, you can do a wet mount where you let this organism incubate for a couple hours in a broth type media, and then once you put it under the microscope and look at it, you can see that organism flipping around end over end with a tumbling type motility. Or if you were to use a solid agar, you would get, once you stab that agar, you would get an umbrella shape at the top of it with that growth pattern as that organism is motile and able to spread out through that agar. With your negative motility and your esculin hydrolysis negative, we're looking at Corynebacterium diphtheria. And with this, your gram stain will be small gram-positive bacilli that will have a coryneiform or a club-like type morphology, which is also termed a Chinese letter type appearance. These cultures are dry with a small zone of beta hemolysis. They are small, gray, transparent to medium white and opaque, so you can have some variations in its appearance. And also on two different special media, these organisms can present as a black colony. And then toxin testing is usually done to confirm the particular toxin that these organisms produce. Here are some images of how these organisms appear. So you can see that hemolysis with that listeria. Here you see the positive umbrella test where you have that growth that kind of spreads out through the agar. And so what will happen is this organism is used with a needle when it's cultured from the culture plate, um, a metal needle is stabbed down into this agar. And so you should see growth close to the top because it can get access to the oxygen. And you can see where it grows within the top of that stab, and then it starts to move out, causing that umbrella pattern. Again, these are gram-positive bacilli. With your Corynebacterium, here you can see that lollipop-looking appearance with that coryneiform. And then over here you can also see that Chinese letter where you kind of have like little V's and Y's formation with those gram-positive bacilli. With your listeria, they're usually found worldwide throughout nature. However, they're mostly associated with contaminated food, including milks, raw vegetables, cheese, meats. They also have a vertical transmission transplacentally or through the infected birth canal. The infection causes listeriosis, which is a systemic type disease in which the infant becomes infected, and it can result in the stillbirth or any sort of neonatal type disease like meningitis, bacteremia, encephalitis, endocarditis, and it can ultimately result in death of the newborn. You also have localized infections which infect the eye, the skin, or even the lymph nodes. It can also cause gastroenteritis with a foodborne type of illness. With these organisms, when it is sent for culture from the placenta or any other tissue, it can be very difficult. So a cold enrichment is necessary to recover these organisms. And with that, the specimen is inoculated into a nutrient broth, and then it's incubated at 4 degrees Celsius or in the refrigerator for several weeks or months to see if that organism will grow within that broth media. There are several virulence factors that allows this organism to escape the body's immune response, and it prevents it from being phagocytized. And it also allows the organism to spread very easily from cell to cell, which allows it to eventually reach the central nervous system or even the placenta. And so in order to prevent any sort of infection, any sort of leftover or ready-to-eat food should be heated before it is consumed. And if it's been stored for a long period of time, then it should be disposed of. It is able to replicate at 4 degrees Celsius, so obviously putting it in the refrigerator will not prevent it from continuing to grow and produce those toxins. And so those who are immunocompromised or women who are pregnant should avoid eating those soft cheeses. Corynebacterium diphtheria is acquired from person-to-person contact through someone who is a carrier. It is a global pathogen, but it's very rarely found in the U.S. due to the vaccine program. The infection caused by this is a pharyngitis type infection where there's a membrane that forms on the tonsils, pharynx, or the nose, and this is hallmark of this disease. And what it can do is actually cause airway obstruction, and it also produces a toxin. You have cutaneous diphtheria, in which the skin becomes infected. And some of the complications that can arise from this organism is myocarditis, kidney and liver inflammation, peripheral neuropathy, and of course that airway obstruction where that membrane starts forming near the respiratory tract. There are other species of this organism that have been associated with various infections, however, they're not as common. So some strands do produce toxins, but not all strands. It does contain a bacteriophage that harbors the tox gene, and what this does is blocks protein synthesis that will result in cell death. And it can cause that pseudomembrane to form within the oropharynx or the nasopharynx. It can also allow toxins to spread, which will cause systemic organ damage. And of course, this organism can also lead to cardiac arrest. So it is prevented through immunizations, um, and also the patient can be treated um, with a diphtheria antitoxin. And so this isn't available in the United States, but with our vaccine program, there's really not a need for it. Patients can receive penicillin and erythromycin for treatment as well. If the organism is determined to be a non-spore-forming gram-positive bacilli that is catalase negative, next we look for H2S production within a TSI agar. And so with this, we can have a positive production, which is Urosepalorthrix rhizopathia. This organism is aerobic, or it can grow in aerobic or facultative aerobic conditions. It demonstrates a alpha hemolysis. It grows best if it's incubated with a 5% to 10% carbon dioxide for 24 to 48 hours, but it will grow within normal incubation conditions. It has short rods with long filaments, and so long filaments are those rods kind of attaching together, sort of appears as like a chain. Esculin hydrolysis negative, VP urease and motility negative. A negative H2S production would demonstrate Gardnerella vaginalis. This is a small pleomorphic gram-variable or gram-negative coccobacilli. And so with this on culture, it will grow a small gray opaque type colony that will have a diffuse zone of the beta hemolysis. And so again, this one will grow in your aerobic conditions, but it does grow best with that 5 to 10% carbon dioxide. It is esculin hydrolysis oxidase and motility negative, and it's hypurate positive. With Urosepalorthrix, you can see on this gram stain that gram-positive bacilli that is filamentous, so you can see those bacilli kind of forming chains. So some of these you can see that are kind of just maybe one or two together, but then some of them you can see that little chain-like formation. With your Gardnerella vaginalis, you can see a little bit of that gram variability where it's not completely absorbing that stain, so it's not quite that dark purple color, but has a bit of a tinge of pink to it. Urosepalorthrix is found in a variety of animals, to include also birds and fish, as well as many other animals, but it's mostly found in diseases within pigs. And this particular organism does resist cold and alkaline environments. This infection is usually acquired through contact with these animals through some sort of abrasion or some sort of puncture wound to the skin. And so what will happen with this is that the skin will start to have a little bit of a lesion to it, and it will develop local cellulitis once that organism has come in contact through that injury. And these lesions can be painful with edema, inflammation, and swelling. The swelling can start to cause the pain with a little bit of a local arthritis. And so these infections do tend to happen within those who are more immunocompromised. However, it is treatable. Gardnerella vaginalis is an organism that is normal human microbiota within the vaginal tissue. However, it can be associated with infections within females, and it can colonize the distal urethra of the males. So with this infection, it is associated with mixed anaerobic flora. However, what happens is that there's a reduction of the normal lactobacillus within the vaginal area, and it can cause the Gardnerella to take over and cause the infection known as bacterial vaginosis. And so with this, once this organism starts to flourish, it will start to increase the vaginal pH to greater than 4.5. And you can start to see the presence of epithelial cells that are covered with that bacteria. And so here in the top image, you can see an image where a slide was made, and you can actually see a normal epithelial cell, so they look kind of like a little fried egg. And then you see an abnormal where all of these bacteria are attached to the surface of that cell and around the edges. You can see the nucleus there. I believe that's what that is. And then you can see the outside edges of the cell, and then the bacteria are kind of congregated around that cell. A lot of times to diagnose this, a wet mount is performed. So a vaginal swab is collected. It is placed in saline, and then it's looked under the microscope. And so what you're looking for is clue cells in which you have an abundance of bacteria attached to the edges of these cells, and sometimes you can't actually see the nucleus. So this cell here at the bottom is more normal, whereas the top you get that there's bacteria attached so thickly to that cell that you can't tell much the morphology. And so infections with Gardnerella are uncommon. However, infections have been associated with a postpartum endometriosis, a septic abortion, and infections after a cesarean birth.